the way the Parsis disposed of their dead. They did not burn them, they did not bury them. They put them out in these buildings called the Towers of Silence, whereby the bodies were eaten by vultures, and this led to a recycling of the resources. My name is Dr. Rochan Pant, and I am an interventional radiologist. So what happened? By the 2000s, the vulture population had plummeted so much, by 98 to 99%, that there simply weren't enough vultures around to eat up the dead bodies that were left in the Towers of Silence. Why did this happen? So this drug, which was called diclofenac sodium, which is its generic name, scientific name, any of you who are interested can look up what brands this name is sold under. A drug which was designed for human use was given to cattle quite a lot, because that is not regulated. And because it was given to cattle quite a lot of the drug remained in the bodies and the flesh of the cattle after they died and was unfortunately eaten by vultures. Now, bird kidneys are different from the kidneys found in, say, cattle. And even with minimal dose of diclofenac sodium, had catastrophic kidney failure, and of course they died of it. And the vultures died in such huge numbers that by the early 2000s, there simply weren't enough vultures. And even now, there aren't that many vultures if you go to any big city. The vulture population just plummeted because of this drug. Why does it matter to you and me? The same diclofenac sodium is available in over-the-counter medication, which you can walk into your local pharmacy and just buy. You don't need a prescription. You don't need to see a doctor. And you can just buy the drug. You hurt yourself playing football, your knee is swollen and painful, and you need to go back to college, work, whatever it is. So you take this gel, which the pharmacist probably tells you, ye lelo, take this, and you'll be fine tomorrow. And you apply that gel, not knowing the gel contains diclofenac sodium, which is going to get absorbed into your bloodstream, because that's how the gel works. If you keep using this gel or these tablets, it is also available in tablet form, for days, weeks, months, or years, it can certainly damage your kidneys. And we do see patients, to get over their daily tasks, they have been taking these drugs day after day after day, and nobody told them that this can happen. And as a result, they are now on dialysis. So in fact, a lot of drugs that we routinely take for pain, say knee pain, back pain, other pains, are members of a group called Non-Steroidal Anti-Inflammatory Drugs, NSAID. Incidentally, aspirin is also a member of this group. So is, say, paracetamol, diclofenac sodium, and many other drugs, ketorolac, etc., etc. Of members of these group of drugs, quite a few of them, can have harmful effect on the kidneys, which is why patients who already have a kidney damage are strongly advised to get a long list of drugs that they have to avoid. But nobody counsels people that you may already have some kidney damage, and taking these drugs indiscriminately may push you over the edge to the point where instead of living independently, you become dependent on dialysis or need a renal transplant to survive. Sir William Osler, who's a very famous doctor from the US, he said the first duty of a physician is to educate the masses, not to take medicine. I also hear some other things about drugs which are, for example, plant-based. And people will tell me these are natural ingredients, therefore they are safe. Well, not really. Dhatura, natural ingredient. Afim, naturally occurring stuff. Bhang, you name it. These are naturally occurring things. Half the poisons we use are naturally occurring. Half the drugs which came into modern medicine came from traditional herbs and plants and were refined into modern drugs. Chloroquine, for example, aspirin, that does not make them without side effect. We certainly know that many people have had catastrophic results from taking drugs like this and have undergone liver failure, requiring either an urgent liver transplantation or death. There are no 100% safe drugs. So how can we prescribe drugs as doctors? When we prescribe drugs, we look at many factors. What is the risk of giving the drug versus not giving the drug? For example, ecosprin is a very common drug in large numbers across the globe for many reasons. We do not give ecosprin to small children because small children can be hurt by ecosprin much more than adults can. There are other drugs which we'll not give to patients, say, who have diabetes. There are drugs we'll not give to patients if they are elderly, say more than 80 years of age, which can be safely used in a young person. All these factors are taken into consideration before we prescribe drugs to a patient. The risk versus benefit, the duration for which the drug will be taken, and what are the coexisting illnesses or problems that the patient already has. All these put together is what allows us to safely use pharmacological agents to improve quality of life and many times save your life.